Have you ever left your doctor's office with a new prescription, only to get home and wonder, do I really need this medication? Or maybe you've noticed new dizziness or confusion after starting a new pill, but assumed it was just part of getting older? If this sounds familiar, I want you to know something important. What you're experiencing might not be normal aging at all. In fact, some commonly prescribed medications can do more harm than good for seniors. And today we're going to talk about 5 of the most concerning ones. Now, before we go any further, I need to make something crystal clear. I'm not a doctor, and you should never stop taking any medication without consulting your healthcare provider. But what I can share with you is research-backed information that will help you have smarter conversations with your doctor about your prescriptions. Because here's the truth. As we age, our bodies process medications differently, and some drugs that might be fine at 50 can become dangerous by 70. Let's start with the first medication category that deserves careful consideration: sleeping pills, particularly those in the benzodiazepine family, like diazepam, Valium, or lorazepam, Ativan. My neighbor Margaret learned this the hard way when she was prescribed a mild sleep aid after her husband passed away. At first, it seemed like a godsend, finally getting some rest. But after a few weeks, she started feeling foggy during the day, and then one night, she fell trying to get to the bathroom. When she mentioned this to her pharmacist, she learned that these types of medications can increase fall risk by up to 50% in seniors. Here's what happens. As we age, our bodies metabolize these drugs more slowly, so they stay in our system longer. What was meant to be a short-term solution can lead to next-day drowsiness, confusion, and that dangerous loss of balance. But here's the good news. There are often safer alternatives. Many seniors find relief with melatonin supplements, cognitive behavioral therapy for insomnia, or simple sleep hygiene changes, like keeping a consistent bedtime routine. The key question to ask your doctor: is there a non-drug approach we could try first for my sleep issues? The second medication we need to discuss might surprise you. It's certain over-the-counter pain relievers, specifically NSAIDs like ibuprofen or naproxen when used regularly. Now, I'm not saying you should never take these. They can be great for occasional aches and pains. But my friend Bob ran into trouble when he started taking ibuprofen daily for his arthritis. After a few months, he ended up in the hospital with stomach bleeding he didn't even realize was happening. Here's why NSAIDs can be particularly risky for seniors. As we age, our stomach lining becomes more fragile, and these medications can cause silent bleeding. They can also interact badly with blood pressure medications and diuretics that many seniors take. For chronic pain, alternatives like acetaminophen, though it has its own risks at high doses, topical pain relievers, or physical therapy might be safer options. The crucial question for your doctor: what's the safest pain relief option for my specific situation, especially if I need it regularly? Before we move on to our next medications, I want to pause and acknowledge something important. Some of you might be thinking, but my doctor prescribed these. Surely they know best? Absolutely. Doctors have our best interests at heart. But here's the reality. With hundreds of medications available and limited appointment times, even the best doctors can't always catch every potential interaction or age-related risk. That's why being an informed patient is so crucial. Your doctor will appreciate you asking thoughtful questions. It helps them provide you with the best possible care. This leads us perfectly into our next set of medications, including one that's prescribed to millions of seniors, but may do more harm than good for many, and another that can sneak up on you because it's found in so many common over-the-counter products. But we'll get to those in just a moment. Now that we've covered sleeping pills and NSAIDs, let's talk about a medication that might surprise you: certain diabetes drugs, specifically those containing glyburide. My friend Evelyn, who's had type 2 diabetes for 15 years, was shocked when her new pharmacist flagged this common medication as potentially dangerous for seniors. Here's why. Glyburide stays active in the body much longer as we age, which can lead to dangerously low blood sugar levels, a condition called hypoglycemia that can cause confusion, falls, or even loss of consciousness. What makes this particularly concerning is that many seniors don't recognize the symptoms of low blood sugar, chalking them up to normal aging. Evelyn experienced this firsthand when she started having unexplained dizzy spells in the afternoon. Her Doctor initially thought it might be blood pressure related until they connected it to her diabetes medication timing. The good news? There are newer diabetes medications like metformin, though it has its own considerations, or even certain injectables that may be safer options for older adults. The key question to ask, is this the safest diabetes medication for someone my age? The fourth medication category we need to discuss is anticholinergic drugs. A mouthful to say, but incredibly important to understand. These show up in many common prescriptions for allergies, overactive bladder, depression, and even some Parkinson's medications. My neighbor Frank learned about these a hard way when he was prescribed an anticholinergic for his bladder issues. Within weeks, his family noticed he was becoming increasingly confused and forgetful. They feared early dementia until his doctor connected it to the new medication. Here's what happens with anticholinergics. They block acetylcholine, a crucial brain chemical for memory and cognition. Studies show that regular use can significantly increase dementia risk in seniors. What makes this especially tricky is that these drugs are often prescribed for conditions that already tend to affect older adults. The alternatives? For allergies, newer antihistamines like loratadine might be safer. For overactive bladder, behavioral therapies or different classes of medications could be options. The vital question for your doctor: does this medication have anticholinergic effects? And if so, is there a safer alternative? Now, I know some of you might be thinking, but I've been taking this medication for years without problems. That's wonderful, but here's something important to consider. As we move through our 70s and 80s, our kidney and liver function naturally decline, changing how our bodies process medications. What was once safe can become problematic. That's why regular medication reviews with your doctor are so crucial, at least once a year, or anytime you notice new symptoms. This brings me to an important tool you should know about: the Beers criteria. It's a list created by geriatric experts that identifies potentially inappropriate medications for older adults. You can find it online, and it might be worth printing to discuss with your doctor at your next visit. My friend Carol brings an updated copy to every appointment. Her doctors actually appreciate having this resource handy during their discussions. What's fascinating about these middle two medications is how they demonstrate that sometimes it's not about whether a drug works, but whether it works safely for an aging body. Diabetes management is crucial, but needs to be balanced against hypoglycemia risks. Bladder control matters, but not at the expense of cognitive function. This is where having an open dialogue with your healthcare provider becomes so valuable. Before we move to our final medication, which might be the most commonly overused of all, I want to share a story about my neighbor Sam. He was on 11 different medications when his daughter insisted he get a comprehensive medication review. Through careful work with his doctor and pharmacist, they were able to reduce that to 5 essential medications. The result? Fewer side effects, lower costs, and actually better control of his health conditions. Sometimes less really is more when it comes to medications as we age. This idea of careful evaluation leads us perfectly into our final medication category, one that's prescribed to millions of seniors despite clear evidence that it often causes more harm than good in older adults. Let's talk about that fifth and potentially most concerning medication category: proton pump inhibitors, PPIs, like omeprazole or esomeprazole, commonly used for acid reflux and heartburn. Now, I know what you're thinking, but my doctor said these are safe, and for short-term use, they can be incredibly helpful. The problem comes when seniors, often with their doctor's approval, stay on these medications for years. My cousin Martha was on a PPI for nearly a decade before a new gastroenterologist asked an important question: do you really still need this? Here's why long-term PPI use worries experts. These medications can interfere with nutrient absorption, particularly magnesium, calcium, and vitamin B12, all crucial for senior health. Low magnesium can lead to muscle cramps and irregular heart rhythms, while poor calcium absorption impacts bone health. Even more concerning, studies link long-term PPI use to increased risk of bone fractures, kidney disease, and certain infections. The alternative? For occasional heartburn, antacids like calcium carbonate might suffice. For chronic issues, lifestyle changes like eating smaller meals, avoiding late-night eating, or elevating the head of your bed can often provide relief. The key question for your doctor: can we try tapering off this medication to see if I still need it? Now that we've covered all 5 medication categories, sleeping pills, NSAIDs, certain diabetes drugs, anticholinergics, and PPIs, let's talk about how to put this knowledge into action. First and foremost, I want to emphasize again, never stop any medication without consulting your healthcare provider. Sudden discontinuation of some medications can be dangerous. Instead, use this information to start a conversation at your next appointment. Here's a practical approach that's worked for many seniors I know. About a week before your doctor's visit, gather all your medications, prescriptions, over-the-counter drugs, vitamins, and supplements, and put them in a bag to bring with you. Ask your doctor or pharmacist, can we review each of these to make sure they're still appropriate for me? This simple question has helped my friend Ruth identify 3 medications she no longer needed, saving her both money and potential side effects. Another powerful tool is asking about deprescribing, a medical term for safely reducing or stopping medications that may no longer be beneficial. Many doctors are now trained in this practice, but may not initiate the conversation unless you ask. Try saying, I've heard about deprescribing. Are any of my medications good candidates for this? This opens a door for a productive discussion about simplifying your medication regimen. Let me share an inspiring story about my neighbor George. At 82, he was taking 14 different pills daily and feeling constantly fatigued. After a thorough medication review with a geriatric specialist, they reduced his regimen to 6 essential medications. Within months, his energy improved dramatically, and his daughter joked that he seemed 10 years younger. George's secret? He became an active participant in his medication decisions rather than just passively accepting every prescription. As we wrap up, I want to leave you with 3 key questions to ask about every medication you take. What specific problem is this medication solving for me? Are there safer alternatives that might work as well? How will we know when/if I can reduce or stop this medication? Remember, you are the most important member of your healthcare team. While doctors have medical expertise, you're the expert on how medications make you feel in your daily life. Tracking symptoms in a simple notebook can provide invaluable information for these discussions. I'd love to hear from you in the comments. Have you ever had an experience with medication side effects? What strategies have helped you manage your medication safely? Would you like me to do a follow-up video on how to organize and track medications? If you found this information helpful, please hit that like button. It helps other seniors find this important content. And consider subscribing for more videos about thriving after 60. Here's my final thought. Medications can be powerful tools for health, but like any tools, they need to be used appropriately. Being an informed, engaged patient is one of the best things you can do for your long-term well-being. Here's to your health. May your medications work for you, not against you.